The difference between RPNs, PSWs, RNs, MDs, PTs, OTs, there's so many acronyms, but we actually all worked really closely together as a one unit team.
According to the College of Nurses, we care for clients that have a stable and predictable outcome. And if our client is not meeting that criteria, then we collaborate with an RN who has additional education.
My role as an RPN in long-term care, I'll have up to about 30 residents on a unit, and it's my role to care for them throughout the day, to administer all their medications, to provide any treatments necessary, just to try to keep them safe.
I've worked in surgery, I've worked in oncology, I've worked all the medicine units, stroke, clinical teaching unit. And when I started there, it kind of became more clear to me that there isn't really that distinction anymore between an RN and an RPN. My role has expanded exponentially. The more that I've learned, the more I've been trusted with and the more I take on.
RPNs are burnt out in particular, especially over the past year with COVID and staffing crisis. And the workload that's just on our shoulders right now is immense, and our scope has changed drastically, and I have seen that and lived that for the past 16 years. And we seem to be losing more and more RPNs.
I definitely would say that I feel undervalued by the government, because I don't think that they realize just how many people and how many different disciplines it takes to run a hospital. You know, the people who are cleaning, to the people who are working with the patients, to the people who are doing administrative policy stuff. Everybody has a role, and if you're walking into that hospital, you definitely have something to do with healthcare.
But when the pandemic hit, that changed a lot. I got to the hospital, because at the time I was working multiple jobs, and then I had to pick, you know, government said, no, you can't work in more than one facility, you gotta pick. So I picked the hospital.
We've seen multiple COVID patients come through our small hospital that I work in. We have very limited supplies, we have very limited staff. It's very physically and emotionally draining. There's lots of times where you're crying at the nurse's station because you just can't give the care that you want to. One of my nursing colleagues did test positive and was intubated for 10 days, and she still has not returned to work. As the pandemic has progressed, the staffing issues have become more apparent, and the nurses are leaving the profession in droves.
In the beginning, being called a hero, it felt great to be acknowledged and to feel like, you know, we're really making a difference and we're helping our community and we're helping people through all of this. And then all of a sudden, when they took away the additional COVID pay, it kind of felt like a slap in the face, because we were still mid-pandemic. We were still dealing with all the same issues, yet all of a sudden it was like it was over, but it wasn't.
If I try to talk about how working in this pandemic has affected my mental health, they say, well, weren't you prepared for this? Isn't this what you expected? And this is not at all what I had expected. There's so much that is asked of us, and we do it because we care. But we don't feel that the care is reciprocated.
I love my job as a nurse. I love nursing, but I also need to live my life. I need a career that pays for me to live my life. And it certainly has not in a very long time.
I think the general public doesn't really understand that RPNs are nurses too, and we're a valued member of the healthcare team. We provide excellent care with positive outcomes every single day.
We're caring people, like that's why we're in the profession. We're here to help, and we want to provide the care, and it's just what we love to do. So, you know, we just keep doing it.
I have even caught myself saying that I am just an RPN when I'm talking about my career with friends or family or colleagues, which is degrading, because I am a nurse and I'm a damn good one. And I would like to be treated as one.